Most people with anterolisthesis are told the same terrifying story. Your spine is unstable, avoid movement, and wait until spinal fusion surgery is your only option. But that narrative is wrong, and today, I'll show you why. In this video, I'm going to walk you through a real patient case where we reduced a severe 11 millimeter anterolisthesis by nearly 50% without surgery, hardware, or spinal manipulation. This patient's neurologist admitted he'd never seen this happen outside the operating room. I'll show you the patient's x-rays before and after, explain the physics behind why her vertebrae was sliding forward, and break down the 4-step precision-based plan we used to stop the shear forces, retrain her nervous system, and restore real structural stability of her spine so she could trust her back again instead of living in fear of one wrong move. If you've been told to wait and see, terrified of spinal fusion, or told there's nothing you can do about your anterolisthesis, this video and this case study will change how you think about what's actually possible. Keep watching. Hi, I'm Dr. Graham Jenkins, a corrective care chiropractor in Kelowna, British Columbia. For over 30 years, I've helped people restore their health, mobility, and confidence through advanced, non-surgical spinal rehabilitation. I'm one of only a few doctors in the world who are advanced certified in chiropractic biophysics, and one of just 3 on the entire west coast of Canada. My mission is simple: to help people live strong, active, and pain-free lives for as long as possible. I do that by focusing on real correction, not just pain relief, helping people fix the root cause of spinal problems that have held them back for years. On this channel, you'll find clear, evidence-based videos that explain how your spine and nervous system work, why posture matters, and what you can do to move and feel better naturally. If you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. I upload a new video every week. Let me start with a case most spine specialists would say only has one outcome. This patient was in her mid-50s with more than a decade of back pain, until things suddenly escalated. Her L4 vertebrae had slipped forward over L5 by 11 millimeters. That is severe anterolisthesis. This was no longer just pain. She was losing leg strength, her nerves were being compressed, she was approaching loss of bladder control. That is very serious. When she saw a neurologist, the message was blunt. This is progressive, and it usually ends in fusion surgery. Her job made it worse. Long hours of sitting, day after day, increased the shear forces on her spine and reinforced the slip. The advice never changed. Wait, avoid movement, hope it does not get worse. But it did. When she came to our office, she was scared, afraid one wrong move would cause everything to collapse. Most would say this spine is unstable and needs to be fused. We asked a different question. Why is her spine slipping forward, and can the forces causing it be reduced instead of locking it in place? Now, before I explain how, you need to see what happened next, because it changes the entire conversation. Before we did anything, we measured her spinal alignment. Weight-bearing x-rays showed exactly how far the vertebrae had slipped and how much stress her spine was under when she was upright. You cannot talk about stability without measurement. Her initial images confirmed an 11 millimeter forward slip at L4 on L5. Severe enough that most clinicians stop thinking about correction and shift to symptom management until surgery. After 4 months of targeted structural care, we retook the x-rays and did the same measurements and analysis. The anterolisthesis reduced from 11 millimeters to 6 millimeters, nearly a 50% reduction in mechanical shear force. This was not only about how she felt, it was measurable structural change. When her neurologist reviewed the x-ray images, he admitted he had never seen this happen outside of surgery. For medical specialists, the assumption is that once a vertebrae slips, it doesn't come back without hardware. These post-treatment x-rays changed the conversation. Surgery was no longer the only question. The real question became how the forces acted on her spine and how those had changed. Now, to understand that, you need to understand why her spine was slipping forward in the first place. A forward slip like this does not happen randomly. Vertebrae respond to forces, and in her case, those forces had been acting on her spine for years. The primary driver was shear force. When the lumbar spine curve is increased or posture shifts forward, Gravity no longer acts safely through the spine. It pulls one vertebrae forward over the one below it. Long hours of sitting and postural translation created a constant forward drive force at L4 on L5. Most explanations stop at instability. But instability is not the cause, it's the result. The real problem is unbalanced loads on the spine. And as long as those loads remain, the spine continues to shift regardless of muscle strength. This is why many standard treatments fail. Generic exercises, stretching, or certain adjustments can add motion to a segment already being pushed forward. More movement in the wrong direction does not create stability. It worsens the problem. So the real question was not how to force the spine back, but how to change the physics acting on it. How do you safely reduce the shear forces driving the forward slip? Well, this is where a lot of well-meaning care goes wrong. When a spine is already slipping forward, treating it like generic low back pain can actually make things worse. In her case, the segment was not just painful, it was being driven forward by constant shear forces. Many standard exercises focus on increasing movement or extension. Many adjustments apply force without knowing the exact direction of the slip. This is why spinal x-rays are essential. For a spine like hers, that kind of care can add motion where control is already lost. That is why some patients feel temporary relief, then gradually decline. She had already tried variations of this approach for years. Manage symptoms, strengthen generally, avoid discomfort. None of it changed the forces acting on her spine. And as long as those forces stayed the same, the slip continued. This is why we didn't ask what felt good in the moment. We asked what would actually reduce the load pushing her vertebrae forward. Answering that question required a very different approach. Once we understood why her spine was slipping and why standard care had failed, the decision was clear. The choice was not between waiting and surgery. There was a third option: reduce the forces causing the instability and teach the spine to stabilize itself. This is the role of chiropractic biophysics, or CBP. The goal is not only pain management, it's a non-surgical structural correction method. We use precise weight-bearing x-rays and posture analysis to define the exact misalignment and direction of force. That information guides the entire treatment plan. Instead of bracing the spine and waiting, the goal is to restore alignment and reduce abnormal stress on the discs, joints, and ligaments. In a case like hers, instability is not about weak muscles. It's about how loads move through the spine all day. For her, this meant choosing active participation over passive decline. A structured care plan that required effort, but offered something surgery could not: the ability to stabilize her spine without permanently locking it in place. That's the approach we took. The first step was to stop feeding the problem. Certain movements and generic exercises increase forward shear in a spine like hers, so those were removed immediately. Before you fix a system, you have to stop stressing it. Then we moved into non-surgical structural correction. Using her x-rays as a guide for correction, we designed a plan to apply force in the exact opposite direction of the slip. This was not done with generic traction. It was CBP-based, mirror image traction, aimed at reducing the forward load on that specific segment. This is where the robo-trac table became essential. We are the only clinic in Western Canada that has a robo-trac table. It's a doctor-controlled system with multiple actuators that allow precise control of position, angle, and force in real time. Each setup is based on the patient's individual measurements and adjusted continuously for safety and comfort. The goal is not to apply a force to the spine, but to gradually offload the shear forces driving the vertebrae forward. With the robo-trac, we can dial it in to the millimeter, so the level of specificity for the set becomes much more reproducible. You can see here, this is a typical grade 1 anterolisthesis set, where we have the lower part here keeping the rib cage super stable, so we're bringing that vertebrae back into alignment, whereas then the pelvic piece is positioned in such a way that it's causing that pelvis to drop down and keep that nice and neutral, while we actually can reposition the pelvis relative to L5. So I'll back up a bit so you can see the setup here. So this would be the set that we would use for our second phase with the patient to get further reduction in that anterolisthesis. So this would be a really basic set that we would use in the office. This is a Anterolisthesis table. So most basic certified offices would have this. And so what we've got is the actual spine orthotic. This yellow portion here is called a lumbar spine orthotic. And we have that positioned right below the anterolisthesis. So what's happening is the trunk can shift down. We're also blocking with this strap that's attached to the table. It's pulling the pelvis down into that. So it's actually making this much more effective than just what gravity would have. Now, the one thing that we do for anterolisthesis is I like to keep the knees up because that will also contribute to more of the pelvic tilt that we need. So it opens up the vertebrae at the back. Precision matters in conditions like anterolisthesis. Generic traction can miss the target or increase instability. Robo-trac allows us to precisely address the exact shift seen on imaging while staying within evidence-based safety limits. This approach is supported by published evidence. A 2024 case series by Curtis Fitzgerald and colleagues examined older adults with lumbar anterolisthesis treated with chiropractic biophysics, structural rehabilitation using robo-trac traction. Across the cases, vertebral slippage improved from an average of 14.5 millimeters to 4.2 millimeters, with reductions in pain, improvement in urinary function, and meaningful gains in quality of life. Follow-up exams more than a year later confirmed these improvements were maintained. In my patient's case, this is when the numbers begin to change. But reducing shear is only part of the solution. The spine also has to learn how to hold that correction. If the spine cannot hold the new position, it'll drift back. Many corrections fail, not because the spine cannot change, but because the nervous system never learns to control the change. Stability is not just muscle strength. It's timing, coordination, and the brain knowing where the spine is in space. In her case, years of pain and avoidance shut that system down. The deep stabilizers fired late, and the brain no longer trusted the segment. We trained the stabilizers directly, using posture-based mirror image exercises and targeted isometric work. We taught her nervous system how to recognize and maintain better alignment. The goal was not more exercises, but the right ones to support the correction created by traction. Home care was also critical. Much of her progress came from short, frequent sessions outside the office that reinforced control throughout the day. That's why patients are not passive in this process. Their effort drives the outcome. As her control improved, her confidence returned. Movements that once felt dangerous became manageable again. But the progress is not linear. Structural change happens in phases, which brings us to the part of the progress most people are never prepared for. In her case, the first phase brought a major win. The slip reduced from 11 millimeters to 6 millimeters, cutting nerve stress and giving her spine a safer foundation. The biggest change often happens early. After that, progress can feel slower. That doesn't mean it has to stop. It means the work has become more precise. This is why we moved her into a second corrective cycle. As her spine changed, the treatment had to evolve. She progressed to a more advanced doctor-controlled traction with robo-trac to target the remaining millimeters of instability. These final changes are the hardest and the most important for long-term stability. During this phase, improvement was not dramatic week to week. That is normal. This is where imaging matters. Again, follow-up x-rays confirmed that even when progress felt slower, the spine was still changing in the right direction. The alternative is stopping early and letting those forces return, or accepting fusion as the only option. This treatment process is demanding, but it offers something rare, a clear, measurable path to long-term stability without back surgery. For patients who've been told to wait and hope, that changes everything. As you can see, this was not about managing pain or waiting for things to fall apart. With our patient, we changed the forces acting on her spine, improving alignment, reducing the anterolisthesis, and restoring stability in a way that could be measured with post-x-rays. The result was not just symptom relief, it was a spine that was objectively safer and more stable than where she started. So if you've been diagnosed with an anterolisthesis, even a small amount of forward slippage, I don't want you to panic or lose hope. There's a proven, non-surgical corrective approach that addresses the cause, not just the symptom. One that reduces shear forces, improves structural stability, decreases nerve stress, and has demonstrated long-term outcomes where the spine remains more stable over time. Finding the right care matters. Look for a corrective care chiropractor trained in chiropractic biophysics who uses advanced doctor-controlled traction systems like the robo-trac system. If you need help finding one, leave a comment and let me know. I can direct you to an online directory of CBP-trained and certified doctors. And if you're in the Kelowna, British Columbia area, you're welcome to check us out. We are currently the only clinic in Western Canada with a robo-trac system. If you've learned something new from this video and feel more confident about what may be possible for your spine, please like and share this video. It helps this information reach more people who have been told there's nothing they can do. And if you're ready to take control of your health and start moving without fear again, subscribe to the channel. Here, we share practical, evidence-based ways to correct posture, protect your spine, and keep your body strong for life. If you want to see the specific anterolisthesis and back stabilizing exercises we use with our patients, watch the next video. I'll walk you through them step by step.